Hi, it's Dr. Noel Robert Williams, Oklahoma City, Oklahoma, Optimal Health Associates. May 4th, 2020. It's the day before one of the more important holidays in the United States, Cinco de Mayo, Mexican Independence Day. I hope everyone has a great Cinco de Mayo. Let's talk about COVID. My last post was really Friday night, but we didn't get it out until Saturday morning. Sorry. In terms of video, I did an update just on statistics and therapeutics yesterday, which I'm going to go over a little bit more today. So first, global statistics: over 3 million cases, 250,000 dead. U.S. statistics: I think 1.2 million, 68,700 dead. Friday was a bigger day for death, unfortunately, 2,900. There's some governmental statistics that are pointing towards some 3,000 dead some days ahead because of the surges earlier in April. That's not a surprise. Remember, when people get sick, it's about a week or so after the infection. When they start to feel sick, it's about 4 to 7 days most of the time before they get real sick, and then they're in the hospital for 2 weeks, and those are the ones who have a tendency to pass. So people who are getting it in early April and mid-April that are going to die are going to be dying over the next few weeks, where we had more cases. We had almost 30,000 cases, I think, also on Thursday or Friday. Today, yesterday we only had 21,000. So we'll just have to see what happens over the next 3 weeks. I think May 15th is going to be a kind of a bellwether type day, and then May 21st will be a bellwether type day, because we'll see with the relaxation and social distancing, which I think is ultimately is reasonable. It's just we have to do it intelligently, which means we wear masks, we're on our vitamins, we wash our hands. It's not a free-for-all undo of the social distancing. We have to adjust to changes in life, and if we don't adjust to changes in life, then there's more risks of the social distancing things being depressed or released. So we'll have to see, and then that will tell us a lot about how the rest of the summer is going to go. The current data in Oklahoma, it's about 4,100 deaths, 4,100 cases and about just shy of 240 deaths. Again, the Oklahoma statistics are so meaningless, I can't even describe it. I've had now multiple patients get tested. One's 8 days out. The last one was 7 before they get the results. They can't get any results when they call. I think there's global frustration by physicians who are actually trying to take care of some of these people who want to know if they're infected. Do we need to keep them on Plaquenil if that's what we're choosing to do, which I'm going to talk about, and all that kind of stuff. So, Oklahoma statistics are not great in terms of reliability, but there is an interesting one that was shared with me this weekend by one of the premier infectious disease physicians, that the actual prevalence of the virus in the population with a good antibody test, which isn't an antibody test that you're going to be able to get as a person in most places, it was more of a research tool. The prevalence in Oklahoma was only 1.5% for antibodies to truly COVID-19. So we can assume 98.5% of us have not actually been exposed. So all of you who think you had a cold or a cough or something and got sick, you didn't get COVID. I got really sick at the end of February. It's not going to be COVID almost ever. We just did not have the disease getting into Oklahoma before March, and the real antibody testing, which again is not something I can order, and plus I won't order any antibody testing now because it's useless for the stuff that's available. So really low prevalence in Oklahoma. So again, just interesting data. In terms of treatment, there was something from SERMO, SERMO, which is an international group that does physician polling data on what they're using for clinical treatment options in certain conditions. So they've been really focused on COVID. So really cool stuff. Looking at about 6,000 or more physicians trying to rate what they found has been useful. I'll tell what the most useful thing is, which is important to know because there's some really good news that I'll share tonight, is just this transfusion of plasma. So if you have person A who got COVID, they recovered, and you have person B who's sick in the hospital, giving plasma that contains antibodies. So it gets back to that whole adapted, getting back to the wrong word, sorry, adapted immunity, where you have your central immunity or kind of regular innate immunity, and then you have adaptive immunity where you make antibodies. So that person who got infected made an antibody, taking the plasma where the antibody is, putting it into someone who has the right blood type and all that kind of stuff, who's sick, has worked really well. And looking at this 6,000 physicians, 60 some percent felt that was listed that as the most effective treatment they're seeing. The most effective medical treatment, now get ready for all of you who believe everything the FDA says, it's Plaquenil. Plaquenil is the most effective treatment worldwide for COVID. The trend of the data or these comments are you need to use it early, you need to use it often, but you got to use it early. And there's then the new drug that's been touted by the FDA, Remdesivir, Remdesivir, was again one of the top 2 or 3. Has really in one trial initial data showed a 4-day shortening in hospital stay and about a 25% reduction in death. There was a Chinese study that didn't show any benefit, but it was small. This study's bigger. It's not published though. But the thing that doctors are writing about, and then again talking to someone who is clinically using this med, is it's got to be started early. It's not a panacea. It's not going to fix everything. It's not going to save everyone. But again, it gets back to early use is what we're hearing more and more from people who are actually taking care of patients, not people sitting in an armchair pontificating about all the stuff they know when they haven't touched or seen a patient in 20 years. It's just very disturbing that these people are doing that, but hey, it's our government. But real clinicians, get that antiviral started, get that Plaquenil started, corticosteroids early also. That data is reversing completely from what was discussed or promoted earlier. If you start corticosteroids extremely early, you may just knock the whole disease out, which is actually makes more sense than everything we were seeing. And so everything's about early treatment, meaning don't wait, get the people started on stuff. So that segues into what I think you have to do with someone who you're concerned about COVID. I think you have to get them started on Plaquenil as soon as possible. That's my personal opinion. That's the opinion of 6,000 doctors who treat these people across the world. And so it's just nice to see some uniformity in thought process from people who are actually doing the work. And then the big exciting news, I think, is out of Israel. We're talking about adaptive immunity again. Well, the Israelis in a lab managed to take a beta cell, which is a beta lymphocyte, and from someone who had been who'd been infected with COVID-19. They got that beta cell and they produced and stressed it and produced an antibody that was to COVID, and that's the antibody the beta cell produced to inactivate the COVID. And they've reproduced that, and they've shown that it's inactivating COVID. So that is incredibly exciting. Most antibodies that we want to give are monoclonal antibodies, not polyclonal, meaning coming from several cells. So having a monoclonal antibody that could inactivate COVID is awesome. It's like, to quote SpongeBob, awesome pants. It's the best thing ever. It's not a vaccine, so when you take a vaccine, you take proteins from outside the virus and you inject them, and that causes you to make antibodies that will inactivate the virus if the whole virus comes in, because you're just putting proteins that are inactive. So what they've done is they've identified a antibody that inactivates the virus. They've gotten the beta lymphocyte and made it produce it again, and they've got it. And that's extremely important. So what you do is you clone that cell, and then you get quadrillions and quintuple billions of those antibodies, and then you can do a variety of things with them. One, you can give an injection to treat someone who's really sick. And then what I'm also hoping is some immune gifts or immunity. So hepatitis A, for those of you who've ever gotten a gamma globulin shot, is just a monoclonal antibody against hepatitis A that inactivates the virus if it enters your body. And you get a shot. It hurts a little bit because it's a little bit more of an oil and it goes into the muscle. And then it gives you 1 year of protection against hepatitis A. So having a monoclonal antibody for COVID that looks super active and effective. And again, it's initial data, but they've patented it and they're looking now to really surge it forward. Could be a complete and total alteration in terms of what we can have to deal with in the next 12 months. So very exciting news, and I'll be following that, of course. Other things just to be aware of. Entering society, data on entering society. I want everyone to start thinking about how do we enter society. I think kids are in really good shape. The data showing they're pretty darn immune, kids under 20. But can they still get it? Yes, it's unlikely. Can they be infectious? Yes, but it's unlikely. So what do we do for them? Well, one, we could have to have them on vitamins. You have to have them on, again, the zinc, the multivitamin, the vitamin D. They don't need the melatonin. And they're going to be really, really immune. And then you focus on the hand sanitizer and good hygiene practices. Now, if you have a child with multiple medical conditions, I think you have to be more conservative, potentially like diabetes or heart disease. Again, relatively rare in a child to have heart disease. But kids are just in really good shape, and I think getting them back into society and letting them mix it up with themselves is really a great idea. Now, what about kids and grandparents? Well, I think we have to be careful with that. But ultimately, if the kid has a mask on and the grandparent has a mask on right now and everybody's hands are washed, yeah, the grandparents can come over and give the kid a hug, okay? As long as they don't have major medical conditions. If they're relatively healthy, they need to be taking their vitamins. That's the baseline for me for everything I'm telling people. Then your immune system works. If you're taking your vitamins and you're in your 60s or 70s and you're otherwise healthy and you don't have any other major issues going on, you can see your grandkids. As long as you're wearing a mask, they're wearing a mask, give them a hug. Yes, you're not going to sit down at the table and eat with them yet, but we're getting closer and closer to that. So I'd really start watching or start considering that if everyone's healthy and has been sequestered. Likewise, going to stores and things like that, how do you handle it? Well, data out of New York is showing that it's the transition zones. So it's going in and out of buildings. It's going up and down stairways. It's touching those rails. You don't want to touch anything if you can. So if you're going to be going into a store, it's that door. It's right as you're going in. That's where the greatest concentration and likelihood of COVID is. So you always want to use that hand sanitizer as you go in. If you're using one of the shopping cart, wipe it off, have some hand sanitizer with you, and really focus on wearing the mask and using the hand sanitizer the whole time you're in the store. The other place that's going to be a huge problem moving forward, as our moms all told us when we were growing up, public bathrooms. They seem to have the greatest amount of COVID in an environment, in a public environment. So you really want to avoid public bathrooms as best you can, as there's going to be a ton of COVID there, and it's hard to keep those places clean anyway, and there's just going to be a lot. And that's some data coming out of New York, looking at the subway system and what's going on in the metro and all of those areas, and where they're seeing the greatest amount of COVID when they're doing little wipes for the virus. So it's these public areas where people are coming through. And so you have to be really careful. That then begs the question, how do we open up things for concerts and sporting events? I think it's a huge problem. But I'm not going to get into that because no one knows what to do about that yet. But it's going to be a problem in terms of, if OU has a football game, how do you get 80,000 people in and out of that stadium if you have, let's say, 1% of them potentially infectious? So, 800 people. Or let's say it's 400 people. And how do you get people in and out? And I think that's a real challenge for the community, any community in the United States moving forward for the next year or two. But I'm sure people will come up with ideas. Kind of last things, I can't emphasize enough the importance of the vitamins, getting outside, walking around, getting some sunlight, and trying to do the things you can to make yourself feel better and self-heal and get some normalcy in your life. That's really the important parts. But I think we can start doing more normal things. We just have to be careful and prudent, have the hand sanitizer, take your vitamins, wear your masks. I'm not endorsing any kind of radical change in behavior where you would just go to the beach with 20 people that you haven't seen and no one's wearing masks, or going to the lake and doing that. I think you still have to be careful, but I think you can start doing things. And that's all for tonight. So have a wonderful evening, and probably won't talk to you on Cinco de Mayo. It'll probably be the 6th. So take care. Good night.